Welcome to today's product showcase featuring SimCapture for Skills with Modular Skills Trainer. My name is Erica Capolino, and I'm the Senior Product Marketing Manager for SimCapture. I'm so glad you're joining us today to learn about our new solution that can help support a competency-based education approach that combines digital technology with hands-on practice. We have a great demo for you that we've recorded with two of our SimCapture experts, followed by a live Q&A. So throughout the presentation, please feel free to drop your questions into the Q&A box and we'll answer as many as possible. So are you ready to turn your skills practice into insights and empower your learners on their path to mastering skills? Let's turn it over to our presenters, Dave Grant and Darren LaCroix.
Welcome everybody, my name is Dave Grant. I'm a former paramedic and former paramedic educator prior to coming to Laerdal, but I've been here for 17 years. And in the last 12 months, I've been working in our enterprise solutions team, supporting the SimCapture portfolio.
And my name is Darren LaCroix. I also have clinical experience of 25 years, also teaching experience, and worked for Laerdal for 17 years, retiring 2 years ago as a senior program manager for the Resuscitation Quality Improvement Program, a program designed to really enhance those resuscitation skills. And I was hired back as a consultant shortly after retiring as Laerdal was beginning an initiative into the nursing market to improve the evaluations and improving skills. And that's what brought me here today. And I'm really excited to be here with you, Dave.
It's good. It's exciting because this is really central to our mission here at Laerdal, isn't it, Darren? Helping produce practice-ready nurses. It's a real challenging task. I know this from my own personal experience as being a father of a recent nursing grad. So it's very close to home, and to be able to support these educators is a real, something that's very, very close to me just personally.
It is. You know, at Laerdal, the mission of helping save lives extends beyond just resuscitation. It extends into the education environment where we're training nurses better, training them to make less mistakes, improve safety, therefore helping save lives. But what we really know also, as you know, our listeners, there's many challenges to this. We've certainly seen a very large shift in faculty and staffing that has resulted in a shortage, both on the education side and, as we'll see later, in the clinical side. Also, the space limitations that we see at some of our schools where there just isn't available time or space for them to actually really work forward to enhance these skills.
And we can't not address the pandemic and the impact that had on campus-based activities, clinical opportunities. And Darren, you mentioned the shortage in the industry of nurses. This is very real. It's a very real problem that just puts pressure on the system,
right,
from all angles.
Right. It's not just a future problem either. This RN shortage is happening right now. Bureau of Labor Statistics report that there's a shortage this year of 1.1 million nurses to provide care, to provide this necessary care for you, the consumer. In September of 2021, the ANA actually urged the Department of Labor to declare a crisis because of this shortage.
So Darren, this isn't a lack of interest in nursing. These are competitive programs.
Sure, they are. Like your daughter, my daughter also is working towards graduation this May from the University of Colorado as a nurse. But when she applied, over 800 applicants were applying for 50 spots. And so that really, was surprising to me. It seemed that we probably could be doing more to bring in more to help solve this shortage, Dave.
Mm-hmm. So really, this is a capacity issue. This challenge to scale up existing programs to produce enough grads who are confident, safe, ready for practice.
There's so many challenges, I think, that the faculty face here. Trying to bring up a cohort of students, for instance, to skills mastery over many different skills the time that takes for you as faculty to actually spend independent time one-on-one with a student, evaluating and providing feedback to them, only to have to do it again for 49 more. Scheduling these students also, another problem. Getting them time in the lab. I remember some of my own experiences in the lab where we actually would have to wait while one person went and completed a skill. And we literally stood in a line for 2 hours for our 15 minutes with that faculty member. And that was it. We didn't get much time. Equipment, just having the right equipment, having been a program coordinator and understanding cost and expense and maintenance of that equipment. Basically, you look at that as all program operations have really been affected and are really challenging to the educators that we have now.
And we always focus on outcomes, Darren. That's what we're about, creating better outcomes. And how are we doing when we look at some of the feedback that comes from the industry, from hospitals, from these employers? We often get the report that there may be a gap, there may be some need for better skills development, a better demonstration of competency before coming to them to be hired.
Certainly in my travel and my work with the pilot programs that have been helping us with SimCapture for Skills, that's very true, that they report that their marketplace, their hospitals report that the students don't come prepared despite all their best efforts. But again, if we look back at those challenges that we talked about, you can kind of understand that this can be a problem. But it's not only the employers that are complaining, or not complaining, but saying this. It's also the accrediting agencies. So we know that accrediting agencies are asking for more and better evaluation of the clinical judgment and clinical performance of students. The other piece is we know that these skills are really front-loaded. In most of the programs that I went to, the majority of the fundamental skills that we're going to skills trainer are all loaded up front. So the student comes into the program, goes into that first real semester of nursing, and has to check off as competent on 12 skills or so. And that might be all they touch it. So coming from that world of RQI, which was really based on a low dose, high frequency delivery of critical CPR skills, I understand what happens when a long period of time stretches out from skills. So I have a student as a second semester student who has completed their skills, has been checked off on a competency, and that's all they see, right? So the rest of their med surg, OB, pediatric rotations, very, very little in the realm of skills. I know that skill degrades. I know what those skills look like after time has elapsed. And I think that's the problem maybe that we really have a chance to do and help with the SimCapture for Skills solution.
So when you talk about spreading this out over the course of the curriculum and more points of engagement, all those things we mentioned about the challenges on the system and time and space, we really need something that's simple, scalable, measurable.
Right.
I think we've got it.
I think we do.
So the foundation of our program, Darren, SimCapture for Skills, is peer-to-peer methodology. Can you talk a little bit about that?
Mm-hmm. Peer-to-peer methodology, as you know, from your training and my training, is nothing new. We've always done peer-to-peer training. We practiced with one another quite a bit when I was going through school. We had paper that would contain an evaluation, or it might be written on a board that we would utilize. We were also expected to tell our partners what actually they could improve on. And so it works very well in that it saves time, right? If I can tell my students to work with one another, practice these skills, get better at these skills, it helps save me time, but it kind of brings up a few problems associated with it.
So I think it's a great time now to introduce our modular skills trainer. So we're going to practice skills. We need something to do it on.
Okay.
One of the earliest skills trainers, of course, we all know was they ever loved orange. It was probably everyone's first injection was on that, or some type of piece of fruit. We've got something quite a bit better and quite a lot more scalable. So this is our Modular Skills Trainer. This is a low-cost trainer that allows for independent skills practice. It really is about extending your lab anywhere, letting students practice the skills in a reproducible, consistent manner. And I think that adds a lot of equity to the training and that experience. And we'll talk more about that. But addressing those issues of resources and scheduling, I can have this as a student and practice 16 essential core skills anywhere I want. And as we look into our support that we have with SimCapture for Skills, I can then get some data from that as well. But let's just talk real quickly about what the Modular Skills Trainer can do. So first of all, you can see it has a face on it. So I can practice, we're going to do oxygen administration today, but I can do NG tubes. You can see I can do trachea care here. There's a little chest piece here that has for a central line where you can do medication administration and just care and dressing of that site. There's wound care. There's just something for an injection. There is a port here for stoma care, IVs. So really can have an awful lot go on here. If you want to just show them that box, Darren, it just comes in a nice convenient box and it's just portable. These can just be issued to the students to literally practice anywhere.
Right, the portability, I think, is what really sets the MST above other task trainers. It's not as if they can take home a mannequin to practice on, is that we have a very portable solution now that handles all of the skills that they might be doing in those courses. But again, considering that they have this the entire time through their curriculum. So some of the feedback that we received from the pilot sites, and I'd like to thank our pilot sites, the University of Massachusetts at Boston, the University of Texas at Arlington, and Penn State University really gave a full-out effort for the past year into really going through and telling us what would work and what wouldn't work for their students. And so without their help, we would have never got here.
So Darren, I think back of years ago when I was in the formative stages of my training, we would have time made available to us where we could access some of the trainers and practice with our peers, but often it lacked a lot of structure. We lacked a lot of direction, and often we felt that some more harm would be done than good. My one fellow student might have one perspective on how things should be done. I'd have another. We'd all remember something different. If I made any mistakes, if someone didn't actually notice it, then it just reinforced that I was okay. And I think a lot of harm was done. We really need some structure to that. And I think that's what we're going to start showing now, aren't we?
Another part of that pilot program, Dave, was exactly that, was the feedback from students telling us that it made their lab time so much more structured, that they were able to give clear and concise feedback to their peer about performance. And this was rather enlightening to all of us, both the faculty that were present and the development team that was working on this. Was the students found structure in the feedback, and faculty also reported that they noticed that their students were giving much better feedback to one another. As you mentioned, I think I've been given some bad feedback, both when I was in the military and in my early career, maybe harmful feedback that made me rather hesitant to maybe step forward and to try something. And that speaks to the equity, I think, that we bring by providing each student with one of the MST devices in SimCapture for Skills, is that every student can practice on their own, at their own time, and have a peer evaluate them and give them good, honest feedback.
Well, I think I'm ready to show it.
Okay.
So I'm going to be the student here today, and you're going to be the student evaluator.
Okay.
So we talked about this being cloud-based. So we've got an iPad here. But this could be any device, couldn't it? I don't have to have an iPad. This is Apple.
Yep. For our purposes, we're using an iPad. We're using the iPad for the device, and you can use a phone. You can use a PC. You can use whatever device can access the web and access an internet browser.
So I've been given a login, And I'm going to go put in my credentials here, and I've logged in. So we're kind of splitting our screen there. You should be able to see. So Darren, right away, I just see a welcome here. So I know I'm logged in properly. It shows that I've completed 6 sessions. I've only been practicing one skill, so I should be good at it. And an average score is 60%. So there's some room for improvement today. So we'll see if I can do that.
Sure.
Now my actual course assignment list here, I see that I've got the Nursing 2401 Fundamental Peer Skills. So I'm going to just select that and see what opens up.
You could probably notice that, that the interface itself is very simple. The development teams and the UI designers put a lot of effort into making this a very simple, easy to understand for the students and the faculty members that are going to use it. So I really, that's been another great experience of them listening to the feedback from students and making better substantial changes in the SimCapture for Skills itself.
So I see I've got 5 things listed here, Darren. I got oxygen administration, that's what we're going to do today. Sterile dressing change, stomach care, nasogastric tube, and then the self-record thing. I'm going to ask you more about that later.
Yeah, we'll talk about the self-record a little bit. We have 4 skills listed here, but you can scale that up. So, right? So if I want to create that course with every skill that my student nurse will encounter throughout their curriculum, I can scale this right up and put all of those skills in. Now, one thing to mention, doesn't have to just be a student nurse, right? We have other programs that utilize skills-based testing and utilize checklist type stuff. For instance, physician programs where they're doing suturing or other advanced procedures. So although we're talking today specifically about nursing skills, SimCapture for Skills also offers you the opportunity in other programs to help your students learn better.
So let's get into this. I'm going to select oxygen administration, and I see it just gives me just a general introduction here, like I would expect, an overview of what we're going to do, that I'm going to use the Modular Skills Trainer. I'm going to demonstrate safety precautions, therapeutic communications, oxygen administration, assessment, and documentation. Now, I can look at my past sessions, but I've already reviewed those, so I'm going to just go ahead and go right to the practice.
Right. So the past sessions gives you an idea of your improvement. It shows you what you scored the first time you did it, and it shows you every other subsequent score. And you can actually go look at the exact things that you missed in there. So you get a very full look at your skill, and you can start to see trends where you're missing specific things, and that gives me that opportunity to really make sure that I'm going to include that the next time I do the skill.
So self-practice, so clearly there's a resource here for me to just practice on my own, but practice with a peer. I've got you with me.
Yep.
I'm going to select that.
So self-practice was another student-driven ask, and also faculty. The students reported that they really like to have the ability to look at a checklist to actually practice on their own. I think you and I had a conversation about our own experiences where I was that student that liked to sit back. I wasn't a student who raised their hand and volunteered to be first. I was that student that if I was going to go in front of my peers or in front of my instructors, I was going to know how to do this skill, right? I was going to know how to do it. And so the self-practice mode was something designed to allow the students to access the interface, to view all of their skills, to practice their skills using that singular skills checklist.
So Darren, the first thing I see here is I'm going to assign my observing peer. So it says 1 device, 2 devices.
So today, Dave, you and I are both standing right here in a lab. This could be an open lab session. This could be a lab session where we're learning and practicing this skill. 1 device is probably enough. You're going to log in. You're going to select an observer or an evaluator. And then I'll do the checkoff as you're standing here because we're physically in the same space. But we did mention earlier about the pandemic, right? And the lack of lab time, the lack of clinical time, and the fact that students were physically separated. And so in response to that, a 2-device mode was made where Dave could log in, select 2 devices, and actually then give me a code by text, by phone, and I could enter that code from across the country.
And join my session.
And join your session. and actually be the one to evaluate you. So it helps with the remote aspect of learning.
That's amazing. Well, we're here, right here and now, so we can practice this in person. So I'm going to go ahead and push start here. I've chosen you as my evaluator, and it says here, we're going to begin. Please hand this device to your observing peer.
Good. So as you mentioned, it's
get that for you.
It's portable, so that we can use it back and forth, right?
Yeah.
Okay, so I've just basically got a checklist in front of me. This checklist just has complete and incomplete as the checkoffs. So you're either going to do it or you're not going to do it, right? But I just want to mention that this checklist is just developed for us, right? We developed this checklist, and we can develop your checklist. It doesn't have to be 2 items. It could be 5 items, right? It could be completed, incomplete, partially completed with feedback, right? So we're able to customize these checklists for whatever need that you have. So we're doing oxygen administration, Dave.
Okay.
You have Jennifer Hoffman, who is a 46-year-old female patient, and the doctor has ordered 4 liters of oxygen via nasal cannula for her asthma situation.
Okay. So I'm going to go ahead and first I'll just introduce myself. Jennifer, my name is Dave. I'm going to be looking after you today. The doctor's already seen you, and he's given an order to give you some oxygen. It's going to help with your breathing. I'm going to get that ready now and be right back, okay? So I'm going to go and just do my hand hygiene. And I will wash my hands, and then I'll come back. And I'm going to just make sure that this is actually Jennifer. So can you just tell me your full name, ma'am?
It's Jennifer Hoffman.
And your date of birth?
I was born in December 1st of 1943.
Okay, and I'll just check that with her ID band, and just so I have 2 steps of identifying her.
Okay.
So Jennifer, I'm going to give you some oxygen. You're going to have a little cannula in your nose opening. Might be a little uncomfortable, but that's what's going to be delivering the oxygen. It's going to help you. So I'm going to connect to my source here, dial in my 4 liters per minute, and then I'm going to place the cannula. So Jennifer, this just comes around here in your nose, and then just up over your ears here. And I will just snug this up under your chin. Is that comfortable?
It is.
So just take normal breaths.
Okay.
And I want you to let me know just how you're feeling if this starts to help. I'm going to check back with you in a couple of minutes. I'm going to just go wash my hands. And while I'm doing that, Darren, I'm just going to glance at that SAT monitor and just see if we're having any improvement at all. And I'm complete. I'm finished.
Okay. All right. So you might have been able to observe that as I was going through the checklist, I was actually checking off these items, and I've skipped one. And so you can see that I can't submit my checklist right now. So all of these really need to be checked. So I can always go back and check the one that I missed.
Okay.
And make sure that's completed. When I submit the checklist, it's going to tell me that it was successfully submitted, and I'm going to take a look at it. And it looks like you did really well. You did all 10 of your items correctly. Actually, I think I missed that you didn't document, but I did check that you did, right? So that's a mistake for me.
I got off easy on that one.
Yeah. So that was the only thing that I saw that you missed. I think everything else was good. But let's talk about that, because we don't want to miss the opportunity to give good feedback. And again, this was something that the pilots felt was really, really important with their students learning to give feedback to one another. So Dave, I'm curious about the importance of documentation, because I understand that it is important to have this care documented. Tell me a little bit about what you know.
Well, we're always told, first of all, that if it's not written down, if it's not documented, it's not done. So because I didn't document it, we just really wouldn't have any evidence that I did it, and it could affect the continuity of the care going on. So I'll definitely remember to do that in the future. Now, Darren, this feedback that you're giving me, that was great. That was based on your experience and knowledge and kind of knowing what skill we were working on today. But as a student, what can we do to sort of prompt them to help them facilitate a better debrief?
So utilizing the checklist is one way. So we could have just clicked on the things that you missed, and we could have utilized that checklist in that manner. But we can also add hint text to the students, so that should you miss something, we might put, for instance, with the documentation, it's important to document the time, the device, the leader flow, and the patient's response to oxygen, right? We might put that hint text into the feedback so that when I did give you the feedback and we have that discussion, I can ask you to tell me that, to come back with that. And if not, then I can say, well, remember, it's important to do these things. So the good point about that, it's all customizable, right? This isn't a skills list we provide you. You provide the skills list to us, and we put your skills list into this.
So Darren, there's one other thing I wanted to ask you about this. When I was on that home screen, if we could go back there.
Let's finish with the very last screen
please,
before
yes,
we go back to the home screen, is that this is your score. You can see he's got 10 of 10, but there's categories that we've mapped the skill to. In this case, we used QSEN as the category. So we have QSEN, patient-centered care, safety, evidence-based practice, physical assessment. Again, all customizable. If you're mapping your competencies to NCLEX, or you're mapping your competencies to NLN, or whatever you're mapping to, we can map those questions so that you get a better idea of where you stand. We frequently will see a student's not doing well in a specific area, for instance, but we'll talk about this a little bit more. So I'm going to go back to the home screen like you asked. We could practice again. We can view session feedback, or I'm going to go back to the home screen for you.
So when we were in here, Darren, I just noticed one thing at the bottom here. So there were the 4 skills, but then I see oxygen administration, self-record.
The self-record piece, right. So the self-record piece, very nice for the pandemic, very nice for remediation. Self-record is a way that you can ask your students to actually submit a self-recording. And I think you brought your tripod there. Dave's got a little tripod he picked up here from Best Buy or another electronics store. It holds his telephone real well. And Dave might be today opening up this tripod, setting it in front of his MST, and actually recording himself doing that skill. Now, after the recording is done, and it's not done until he's satisfied with it. So if Dave records it and halfway through he says, I'm not doing very well, I need to re-record, you can do that, because we want you to do it to the best of your ability and submit that self-recording when you're pretty sure you've got 100% right. And you can do that over and over again until you submit. When you submit, it's going to go to an administrator who's going to actually score that for you and probably provide you some feedback.
And score it asynchronously. So we're back to kind of supporting that idea of we were doing this to relieve some of the burdens of scheduling and faculty availability. So that's really fantastic. Thanks for explaining that.
We have some faculty that the whole idea of asking all of their students to submit self-recordings, they're super happy with because of that asynchronous scoring. What we found through our pilot experience, I think University of Massachusetts is a good example here. We have 400 students. So when you start thinking 400 students times 7 skills apiece, I think the response was, who's going to sit and grade all those? So that model didn't really work for the University of Massachusetts, but it wasn't long before they figured out what would. As we were discussing what happens when a student fails a competency, every school that I've been to has said there's a remedial session that's conducted for the student. And when we spoke to them about what the timing was of that remedial session, it is up to 3 hours per student for a faculty member to remediate and check again the competency of that student. And so at the University of Massachusetts, what was described was we're going to have our students who need remediation submit a self-recording prior to coming into the remediation. So when you think about that, is now I'm putting the ball to the student and saying, before you come in for your remediation next week, I need you to submit a self-recording of you doing the skill all the way through to the best of your ability. And the student comes in much more prepared, and the anticipation is that it takes 2 hours off of that remediation time. So again,
if they were like me, I'd probably be re-recording that video a couple of times to know I had it perfect.
They do, and I think that's the again that saves time. So looking at saving time, asynchronous, the faculty can look at that on their time, but the student shows up better prepared, and not only better prepared, they tell us they're more confident when they do show up. Right, they're more confident in their skills. students also reported that prior to going to clinicals, that they would sit with their device and actually practice the skill to improve their confidence so that they felt good. You know, I think of my daughter's experience and right in the middle of a pandemic and not being able to go into a lab and having to search around at home for something that she could catheterize that resembled a Foley catheterization. And unfortunately, her description of that to me was we used a Coke bottle. And so she was going into clinicals with that experience. And, which was really scary to me because how about if it's you that's being catheterized by a student who has very limited time, very limited equipment, and very limited practice, right? And so the MST really helped solve that. I was able to get her a little demo unit long before they went out, so I could learn it also. And it really helped her skills. She felt much more confident in her clinical experience. And again, that was reported by the students through the pilot visits, so that this improved their confidence quite a bit.
So Darren, we've talked about a lot here. We've sort of talked about the need and sort of set the stage for this. You said a couple of things mentioning about paper checklists and how those can really compile and be boxes on boxes, and the ability to take that paper data and putting it into a meaningful, usable format where we can get some actionable insights out of it.
Right.
Now we can do this with SimCapture, can't we? Can you show me where all this data is?
I can, and I'll talk a little bit about what's done with that data, right? Mm-hmm. What is done with all this skills data? As you said, it used to just reside in a filing cabinet. We saw just piles and piles of skills data in a filing cabinet and maybe in a student's file once they passed it for that one competency evaluation in their second semester of school, right? And so what we have found is that by collecting this data, we get two things that are really important. We get compliance data, right? I want to know that you are in fact practicing. And this was a problem with our peer-to-peer. Mm-hmm. Our instructor might tell us to practice, and as soon as they left the room, Dave goes his way, I went my way, and we'd be sitting over there talking on the cell phones or doing whatever we wanted to do, not doing what the instructor asked us to do, but self-reporting ourselves as doing that. So we can now take a look and make sure that students are compliant with their activities. So that's one aspect that this brings us. But every time that I was clicking on that checklist, I was creating a data point, whether you did it or whether you didn't do it. And I have 50, 100 students going through my program. I'm getting data points on every single student that's practicing this skill or these skills. And I can take a look at that data by the question, and we'll look at that in a moment, and I can find out where are they struggling, right? What is what are they missing frequently? And now it changes my role as the instructor. I don't have to go back in class and say, okay, class, everyone gather around. We're gonna put our skills and we're gonna do the skill over again, step by step by step until you're able to get this correct. I can now go in and say, let's talk a little bit about what it means to document in your patient's chart. What's important about documentation and what should be there? So now my feedback to my learners is focused, and again, I'm going to save myself some
Closing
time.
some of those gaps.
Close those gaps and save that time, right?
So you'd mentioned that this is web-based. Faculty can access this data web-based also.
That's correct, yeah. So I'm going to switch over here to the faculty interface and give you a little run through of some of the reports that come with it. And so now on your screen, what you should be looking at is you should be looking at the administrator view of this. SimCapture for Skills is based on the SimCapture Enterprise platform, which is a very powerful platform that is giving evaluations to students and collecting that data within the student's portfolio, within the cohort portfolio, and eventually the program. It's capturing data on every single one of them. We have details about the course itself that you can see. So Dave had read those before, what the course is, what the objectives of the course are. We have the actual curriculum itself. So you're looking on the screen now at the skills that we put in that you saw when you logged in.
Yeah, so that's the exact same 5 I was looking at there.
That's right. And it could be many more, right? So we're not limited to a specific number. There might be self-recording for every one of those skills available for the student. There may be 12 skills listed here that the student continues to carry through the curriculum, right? We don't want to see that skills decay anymore. And this is something I think that by looking at the data, we realized that there was a gap, that gap in students doing it and being checked off at a fundamental level and really never ever seeing the skills. At one of the schools, one of the interesting data points recently that we shared with them was we looked at the number of times students were doing skills, and we saw that they were really practicing a lot with the NG tube. They had over 400 NG tube attempts with 30 students. But what they didn't have was medication administration. They only had like 30 attempts at medication administration. Now, knowing the field and simulation and why we do simulation, I know that medication error is one of the number one errors in the hospitals right now, right? Simple medication errors. And what we unfolded by looking at the data was that the students weren't even practicing the medication very much. And that gave faculty the needed information to go back in and put the focus back on skills.
Have that ability to course correct on something you might not have had visibility otherwise.
Right. Now, one thing I'll talk about that was also a really good learning for us through the pilot groups was the students rating one another, right? It's kind of difficult for me to look at you, Dave, who you might even be senior to me, and me to tell you, well, you didn't do this and you didn't do that. And what we found was that students were very, very susceptible to just saying, well, I know you would do that if it were really the checkoff, so I'm just going to put that you did it. Don't forget next time.
That sort of goes back to my point where you could have some harm where you just have a room full of students alone.
Exactly. And so we saw these really high scores, and we had to ask ourselves, why all these high scores? And the students reported two things. One, they felt that faculty was watching over them and was going to utilize that information as a punitive measure to them. And so that was kind of scary to them. The other piece was they just felt like, well, we're just practicing anyway, right? So the initial round of data was kind of skewed. And we had to ask. And so the administrators actually checked with students and said, why do you do this? And those were what were reported. So knowing that, what we did with the second round of the pilots were we really emphasized that this is formative. Peer-to-peer training is not summative. And faculty need to know that, and students need to know that. It is for students to get better. And the only way you get better is by understanding where your weaknesses are and putting in measures really to correct that. And so we really emphasized that through the second round of feedback and put in a practice mode. And that really made a big difference. So we emphasized the safety aspect of simulation, that we are actually keeping you in a safe environment where you're free to make a mistake and learn from that mistake by getting good feedback. And so that's some of the good things out of this.
That's an interesting thing to learn. We always know that any good program is always, its impact always comes from being implemented well. So that's some important tips to have picked up along the way.
Well, I'm glad you mentioned that because that is something that we recognize as a need to make sure that we implement. So we provide those tools to, for instance, in the e-learning pieces, I specifically put a piece about giving feedback, how to give good feedback. And it was the same things that we do during our high high fidelity simulations, where we go into a debrief and we kind of, we're inquisitive. We ask the question, we encourage the students to answer instead of telling them. So it was feedback like that, but it really made a difference in how the students responded to it. And so we actually included that in the second round. And again, we started seeing that the students were scoring themselves more authentically and actually enjoyed the experience better and liked to know where it was that they needed to improve. So we'll now look at the reporting here. And I've got the reports up now. At a glance on the home page with the course page, I can hover over those two bars. And what you'll see is the first one that I've hovered over is sterile dressing change. I see that someone scored 100 on it, and my minimum score is 71, and I can see quartile percentages. So just at a glance, they seem to be doing pretty good with the sterile dressing. But when I come over to the oxygen administration, I can see the same thing, and I can see it's a little bit lower, right? And so maybe my emphasis is getting more oxygen delivery training now, focusing on that to help bring up that score.
So Darren, this is real-time data too, right? Like the skill I just did and the data you collected is part of this.
That's right. Because it's a cloud-based system, it's instant. So as soon as we start collecting that data, the data is fed into the reports. You don't need to wait for days. There's nothing to upload. It's all done right live as you saw it right there. So yours is in here. We'll even look at it here in a minute.
So what else can we tell from the data set that we've got here so far?
I can see my high-performing categories and I can see my low-performing categories at a glance. I can see that in the patient-centered care, they're doing fairly well. That's the highest performing. And I can see that in informatics, the documentation, that's where they're not doing.
Interestingly enough, the one that I missed that you actually gave me credit for, but I missed it. So we've got a gap there.
Yeah. This is just a glance. Now we're going to go a little bit deeper into the reports. Again, this is built off the SimCapture Enterprise platform. And the SimCapture Enterprise platform has the same type of reporting for any type of things that you're doing. So right now I'm looking at the course scores here, and it gives me just an aggregate of each student and their entire course score. I might want to know how are they doing right now in the area of safety, and I can go over to my filters here, go to a question category and select safety, because I'm interested in knowing, are they actually understanding that? And I can see that there's a curve towards the top. It doesn't look too bad. I have a lot of zeros over here. These are probably either incomplete skills that someone hasn't completed, not good data for me, but I can see that curve's not too bad. So safety is not looking too bad overall. But again, we've only done 2 skills out of the 5 that are there. So we want to keep an eye on that. Now, I'm going to just want to look at how they did on oxygen administration. One, I want to make sure that everybody did it, right? I asked that they practice this skill this week, and I want to make sure that everybody did it. You can see now you have a distribution of scores showing on the screen there, and that distribution really looks like a pretty nice natural curve. So I'm guessing that that it's not too bad in its standard deviation, that most of the students are doing well. I see all my students and I see their scores. And if I want to, I can sort their scores from high to low, low to high, whatever I want to do, and make sure everybody's done it. And I see a complete set of people who have all done their skills. And that's good. That's what I'm looking for. They've at least done it once. I can go deeper and look how many times you've practiced your skills, right? So if I see that you're having a problem and I look that you've only practiced your skill one time, I can give you some feedback about you need to practice more, right? So I can look at this in many different ways. Another nice piece is that I am able to download this in an Excel format. So we know that a lot of people really enjoy taking data and doing something with it.
So for further research or to be able to slice that data in a more advanced way again,
that's right.
You've got access to it.
That's right. I can open up that Excel spreadsheet and I can see every aspect that they have done, every skill, all of their scores. I can look at the course statistics. I can look at scenario statistics. I can look at the individual scores of each one of those skills. Beautiful export of all of the data that's collected through each little click. Again, this used to live in the filing cabinet.
Yeah.
And there was no way to really look at the scores in any real valid way where you could make sense of it unless you took the time to actually manually enter those into some type of engine. So
I know we're getting close to the end of our time together, and we want to take some time to have questions, and we'll go back to Helen. What else can you show us here in terms of reports that are available?
Yep, so I can come here, I can look at a learner score statistic. So this is a page that lists every individual learner, and I can see how they're doing on each skill, how they're performing in a category over there on the left-hand side of the screen.
This is drilling
And
down on an individual student level.
student, but it also compares that student to the rest of the class. So
Outstanding.
that student, if I provide the student this report, release it to them, they're able to see how they're performing and are they performing as well as the rest of the class. Here's the report to me that really means a lot. So I'm going to go past the statistics and go to the question analysis. Every one of those questions that I just clicked is listed here. And it tells me 44 people did not complete hand hygiene. 163 people did do that hand hygiene. So they're at 78.7% of the class is actually doing it, right? So we can see that. You can see a bar graph that indicates red for people that didn't, green that didn't. And at a quick glance, look at the number one problem, Dave.
Yeah, back down to my documentation problem.
Yep, we're seeing a lot of the students missing on documentation. So now I can highlight the need for documentation, or perhaps in their skills list here, we can provide them with a documentation sheet where they can actually practice real documentation. This is big. And I can filter this as I can filter it by you, the evaluatee, the person who's been evaluated, and see how you've done on your attempts. Or I can look at how an evaluator is scoring someone, right? So maybe we've got that one evaluator that gives everybody hundreds, and then I've got the one evaluator that no one gets 100 ever, right? I can look and do some rater reliability through this. Again, just like before, this is exportable. So this report can be exportable just like any of the others.
So speaking of documenting things, people have taken some time to type some questions
All right.
into our QA box.
Mhm.
That's right. We do have quite a few questions that have come in throughout the presentation. So Darren, let's get into some of them. The first question that we have for you is, how would faculty get trained on using this new solution?
So when we were doing the pilot work, we determined that we wanted to make this as easy as faculty as we could. It is an implementation, right? So I want to say that. And so when we use the word implementation, it requires some thought. How will I utilize SimCapture for Skills in my environment? And to kind of help with that, we started with some impact managers. And these impact managers are there to support that whole implementation. They help you get rolling. They help you understand how the evaluations are used. I think we've had to go in and really differentiate the peer-to-peer experience versus the summative experience. So we're learning quite a bit as we do it. So you're assigned an impact manager who reaches out to you to understand your program, to understand your needs, and ultimately to get you up and running with at least 3 skills, so they even enter your first 3 skills for you, and then train the trainer type teaching sessions. They also stay with you, so that's also important, is that our impact managers follow up with you, answer your questions, and assist you with any complications that you might encounter.
Yeah, that's great. I think they add so much support far beyond the initial purchase. They're there to support you along the way. So that's great. The next request is about checklists, and they're asking, how customizable are they?
So the checklists are your checklists. They're what you use in your program. I would say that they're completely customizable. And in fact, we have to do quite a bit of customizing. Back to the peer-to-peer concept, is that you probably don't want to have a question that says students performed hand washing and have something that says passed or failed as the text. And so our impact managers have helped take existing summative checklists, because maybe that does work in a summative situation, but they've helped customize those checklists so that the checklists themselves reflect more peer language. Yes, no, for instance. It seems simple, but it's some of the things that we've learned.
Great. During the demonstration, you also mentioned about hint text, and I know we also have some open text fields as well. Do you want to touch on those?
Sure. So the hint text actually is now taking on, I think, a little bit more prominence than we probably thought that it might. Initially, it was kind of an idea. Thought, oh, you could prompt a partner with this text, or this is what you should look for. But what we've been discussing with some of the schools now is actually adding very good, robust hint text. For instance, in hand washing. Hand washing is a primary method of, stopping the transmission of disease, something that might come from your textbook, and adding that in so that as the student is practicing the skill, say on their own, I'm at home and I've got my MST trainer and I want to go through my skills checklist now, and I want to start to learn this skill, that they utilize the hint text in a way that reinforces what's happening in that classroom. So putting definitive statements about hand washing, putting definitive statements about the need for sterility during specific procedures, which is really nice. The other, you mentioned about free text fields, Erica. So I can make the choice when I'm building the checklist, back to the customizable aspect of it, to select that if you choose no, or needs improvement, for instance, or had to be prompted, that it can provide an open text field where I could actually type in some comments to the participant.
Okay, great. The next question is this intended to be used by students on their own or some other use model?
So I just mentioned one of the pieces that we included after the very initial pilot. So now I think we've been probably running 18 months or so with SimCapture for Skills. And I'm sorry, I've lost my, ask me the question one more time.
Sure.
I was going in a different direction.
The intended use model. So should it be students on their own or some other way?
This has been a good one because you can't remove the faculty from this, and it was never intended in that way. We created a practice session or a practice mode where I just kind of described a situation where perhaps I'm at home and I know I'm going into the lab tomorrow to do some skills. I can open up my SimCapture for Skills app with my MST, open up my skills checklist, and use my hint text as I go through and just review and learn. It's a practice attempt. I don't need someone evaluating me. I just want to practice. I want to acquire that skill. Probably after your initial lectures, when you've lectured about skills or demonstrated a skill in your programs, you probably ask the students, okay, I've shown this to you, now go practice. And what SimCapture for Skills allows them to do is practice by themselves with the peer, however they want, to acquire the skill. So that's one method of doing it. Eventually, they're probably going to get to a level where they've been now in labs maybe once or twice. They've practiced. You've looked at their practice, how they're practicing, and now you want a peer evaluation. And so now you step up to, okay, I'm ready. I'm now choosing a peer evaluation. So that's where in the reporting now for faculty that becomes valuable, because now I can see how you're rating one another, how a specific rater rates, for instance. Are they being too easy on one another? Do we need to talk about the need for honest evaluation? But you can see that in the peer aspect.
Okay, great. Speaking of the reports, in the demo, when you were showing the reporting screen, someone noticed that there was a calendar tab within the tool. You maybe want to touch on how this is built on SimCapture, the enterprise platform?
Sure. So SimCapture Enterprise is a very large platform, right? It is a system of what we call nodes, which are captured devices, which actually capture camera feeds, microphone feeds, your monitor needs. SimCapture Enterprise also has calendaring features where you actually schedule your sessions, schedule the people, schedule the equipment, and schedule that time in that room. And so that all works together so that when I put a calendared events on the calendar, that the system knows, and on that day I launch the calendared session. It brings over the scenario, the course, the people, all the things that are necessary for that specific event. Bigger part of SimCapture Enterprise. Again, SimCapture for Skills is built on the enterprise platform. It's easy to move up. Say your program begins with SimCapture for Skills, which is a wonderful way, by the way, to get into the new world of evaluating your programs, is that you can come in with skills and start your skills evaluations. but you'll very, very quickly see the value and say, I want to be doing that in my high fidelity simulations. And so the enterprise platform is set up to continue, right? So they could come in and configure those things. And that's something you talk with your client executive about.
Great. We have another question about how do the students actually access those checklists, and they're asking if they need to download an app onto their devices.
There's no app for this. This is simply a web-based design. So the only thing that a student needs is a device that can access the internet, whether they do it through Wi-Fi, whether they do it using cellular data, it doesn't really matter. But once you, the administrator, create a course for them and include all their skills that they're going to need in your course, once you've added them to it, any device that the student can access the internet through a web-based browser, Firefox, Safari, Google, Edge, any modern browser, they can access it. No app needed.
Okay, great. Someone is asking, how do you have to use the Modular Skills Trainer with SimCapture for Skills?
The Modular Skills Trainer is a wonderful device, as we mentioned during the program. It really promotes some independent use and independent acquisition of skills where they can, after being taught, start to practice those skills so that when they do come back to your lab, they're better performers, and your job as faculty now becomes fine-tuning. So 16 skills, at home, for instance, in many cases. So that's a great device, love it. However, head to toes really don't go real well on the Modular Skills Trainer.
Yeah, there's
However,
no toes.
there is a checklist, though. There is a checklist, and that checklist can be utilized. You do not have to have the Modular Skills Trainer. I think of it as the Modular Skills Trainer is the task trainer, right, for that individual student who's going through these skills. But you can do this on standardized patients. So again, really one of our impact managers had a wonderful idea about a psychological scenario that could be presented where you're checking off that they actually go through a survey utilizing a standardized type patient approach. So again, many uses for it. The new thing I mentioned during the thing, my daughter was in nursing school. Well, now she's graduated. And she's already hired, probably as most of you can expect, a new RN. They get picked up before they even pass their NCLEX, which she has done also. So I'm real proud of her. But what I noticed is when she's in her hospital orientation right now, and they're actually going to a hotel to do their simulations. And this really brought up a really interesting thing that all hospitals on board, all hospitals really re-verify their skills, or they might have to make some changes in the way they were taught. But the Modular Skills Trainer suddenly has a use there. And we do have some customers who are onboarding right now that are hospital-based clients who onboard students. What better thing to have, for instance, than a good self-recorded video of an employee or a student, again, back to your nursing program, performing this skill and being evaluated in your program. It gives a lot of value.
Yeah, definitely. I do see a couple of questions coming in about configurations and how it might work for their program. So I am jotting down your names off on the side, and we will have someone follow up with you personally after this call, just to give you, a customized answer based on your setup. We are coming to the top of the hour here, so I do want to thank everybody for your time and for joining. You will receive a recording of this webinar within the next few days, so be on the lookout for that. If anybody happens to be attending NLN Summit next week, please stop by the Laerdal booth so you can actually get a hands-on demonstration of SimCapture for Skills. If you have any specific questions that you want us to answer, or if you'd like us to follow up with you following this call, please feel free to drop your name in the chat box and I will reach out to you. Otherwise, I hope you have a wonderful rest of your day. Thanks for joining us.